I was debating. I was like, how do I do something that's both Halloween costume and Grand Rounds?
Oh yeah,
So
this
we,
is
you know, we
great.
thread the
Yeah,
line.
you did it. All right, we'll get started as people hopefully will trickle in into the audience both here and on Zoom. It's really a pleasure to uh, introduce our speakers today, but I'm going to start first by acknowledging that Dr. Hirsch couldn't be here today, so he sends his regrets, and then doing a land acknowledgement because we always like to acknowledge that we're on the land of the Ramaytush Ohlone people, who are the traditional custodians of this land, and we tend to bring that up to pay our respect, but also to really acknowledge that part of what we're trying to do with Grand Rounds is to build and grow our community and our sense of community in the spirit of what the traditional custodians of this land found a really important piece of being here. Our speakers today are going to actually talk a lot about, it sort of feels very connected to this ancient history because they're going to talk about things that threaten the land and sort of the earth as a whole, as well as the health of children and people in general, I think. And that's at the topic of environmental health, which didn't exist in my experience when I was training, but right now it's really a hot topic. And the two speakers that we have today, Dr. Stephanie Holm and Dr. James Nolan, are both experts in this area. Stephanie Holm has a lot of things behind her name, MD, PhD, and MPH. She's a pediatrician by training, one of us. This is why she's wearing appropriate Halloween and Grand Rounds costumes. She is a physician specialized in occupational environmental medicine, an epidemiologist, the MPH, and she's particularly interested in airborne exposures and how they contribute to pediatric health and well-being. She's board certified in both pediatrics and occupational environmental medicine, trained at Children's Hospital and Research Center Oakland and UCSF, respectively, and has a PhD in epidemiology from UC Berkeley. She leveraged her training in both clinical medicine and public health to do environmental epidemiology research, communicate research findings to the public, and to help move those findings into policy actions. Dr. Holm is the director of the Western States Pediatric Environmental Health Specialty Unit, a group that focuses on education and outreach regarding children's environmental health. And she serves as a member of the National Academies of Science, Engineering, and Medicine Committee on Personal Protective Equipment and the Advisory Council for the Bay Area Quality Management District. And I checked this morning, the Bay Area quality was actually quite good. 27 is the first thing I saw this morning. I don't know why I looked, but I saw it. And then Dr. Nolan has a Master's of Public Health from UC Berkeley, where he specialized in social determinants of health disparities associated with racism, classism, sexism, and geography. At UCSF, he works for both the Western States Pediatric Environmental Health Specialty Unit and the Earth Center, focusing on engaging community members in addressing social determinants of health and environmental injustices, with an emphasis on diversifying STEM fields and harnessing community assets. So really, no better people to talk to us about children's environmental health. Welcome.
Thank you so much for the intro. Nice to see you guys this morning. Like Sanjin said, both my colleague James and I are going to be speaking. So he's joining us by Zoom. I'll take the first bit and then I'll hand off to him later. So you'll get to hear from both of us. We get funding from EPA and CDC, which we very much appreciate, but we don't make official policy statements for any of those people. That's all that says. All right. So the learning objectives for today are for you guys to know where to access some reliable children's environmental health information. I think similar to what Sandrine said, I know when I was a pediatric resident, I learned about lead, and that was about it for environmental health. And so we want to make sure you guys know where to go for reputable information, as well as stuff that you can give your families. And then also be able to define environmental justice and explain why kids are particularly vulnerable to environmental insults. So we'll start with what and why, and then we'll talk about a resource that we have that we put together at the PACU based on the AAP's Green Book, which is the environmental health. We call it the Green Book because it's green. Go through some of that with you guys, go through some of the basic key concepts in there. And then James will go over the patient handouts, which are our prescriptions for prevention, and tell you about how to access those easily. So just to start with a definition, because I think this isn't an area that's as familiar to folks, environmental health is really a branch of public health, and it's the one that focuses on relationships between people and their environment, promotes human health and well-being, fosters healthy and safe communities. I think sometimes when we say environmental health, people think that we're like tree huggers, which we are, but that's not actually the definition of environmental health, right? It's all the things that surround you. So it's not just related to sort of being out in nature, but what is your built environment like? What are the different kinds of exposures you get in all of the different spaces where you live, and how do those affect your health? So I like to just sort of pull. I think sometimes people are like, well, I don't, this isn't something I've thought a whole lot about before. Do I really need to know? So this is just last week I pulled things from the news just within the last year, examples of things that really are environmental health concerns that affect your patients. So there's an example of a hazardous leak from a business in Fremont early in January, discussion about, broader activism and children's environmental health related to air pollution exposure. You guys probably remember the FDA lead in applesauce that got a lot more press than a lot of environmental health things do. So that obviously happened earlier this year. PFAS water contamination, et cetera, right? Like there are tons of these that are happening all the time. And so if you haven't gotten questions about them from your families yet, you probably will. And so it's really useful. And, just so that to acknowledge that this isn't an aberration, there's last year's set of news articles too, right? So it's really easy at any point to just go and grab things that are pediatric environmental health related. All right. I know that often people who are at Grand Rounds have lots of, conflicting obligations, and you might have to leave early. So I like to give the punchline up front, which is that if somehow you can't stay till the end, this is our online resource. I've got the QR code there. You can snag it. If you know how to bookmark things on your phone, I highly recommend even just bookmarking it so that like 8 months from now, when somebody asks you and you're like, oh, there was that site, I don't know what it is, you just have it bookmarked on your phone. It's the Pediatric Environmental Health Toolkit. So if you can remember that, it's also PEHT, Pediatric Environmental Health Toolkit, peht.ucsf.edu. And we'll talk more about it, but bottom line up front, you've got it. All right, so the toolkit has 4 different sections that it's broken into, and I'm going to just sort of orient you guys to this toolkit as we go through some of the concepts, so that then you'll sort of have those interwoven together. 4 different areas are environmental hazards. That section goes over specific toxic chemicals that you might want to know about and that affect children's health. There's then a section on exposure sources, so that's a little broader. It's the things like air, water, foods, consumer products. Key concepts, obviously we'll go over a bunch of those today. And then the anticipatory guidance section has, at every well-child visit age, 2 to 3 environmental health bullets that you could add in with your with your regular well-child stuff. So sort of complementing what's already in Bright Futures. All right, so moving into our key concepts. I think one of the most useful things that we can all do as pediatricians when we get asked about environmental health exposures. So, whether that's wildfire smoke, whether that's, any of these things that our parents or even school districts, any of those folks that you might be talking to might ask you about. It's that kids really are uniquely vulnerable to these insults, right? So the first reason is that kids have behaviors and preferences that increase their exposure to, frankly, most environmental toxicants. So let me give a couple examples. One that you guys, are more familiar with, right? Lead is really common in paint and various things. But one of the reasons that kids are so much more exposed to it is that it's heavy and it's in dust. And so the settled dust ends up on the ground. And because kids spend a lot more time on the ground, right? I don't sit on the ground a whole lot. I tend to put my hands in my mouth less than your average 2-year-old. I would get less exposure, right? Even if I'm in the same kind of setting. With air pollution, for example, because kids tend to be more active, which is good, right? Like we want them running around, but that also means that they'll increase their minute ventilation and get more exposure to contaminants in the air. They have really restricted diets, right? Part of the problem with the applesauce stuff earlier this year, the kids that got really sick were the kids that were eating like 8 applesauce packets a day and maybe nothing else, right? So it's that kind of stuff, right? There are all these reasons that kids actually end up getting higher exposures to many, many toxicants. And then differences in kids' physiology, right? So things like the fact that kids are growing, right, means that they're going to breathe more air and drink more water and eat more food than an adult does relative to their body size. And then, as you guys know, some of the nitty gritty details of, right, there's all kinds of examples of specific enzymes and different things that are developing at different ages and can help or can affect how you process things. The example I often give there is that in a wildfire smoke setting, I was going to say 10-year-old, but she just turned 11 this week. I have an 11-year-old daughter. And so if my daughter and I and my cousin's baby girl are all in the same space, right, because just naturally as an adult at rest, my minute ventilation, right, so how much I'm breathing relative to my body size, is substantially less than my daughter's. And that's much less even than the baby's, right? And so again, relative to sort of my immune system and my ability to deal with things, I get a much lower dose, even in the same exposure setting, than my daughter or than the baby. And then, as you all know well, right, kids have unique windows of growth and development. So one, that means if you're being exposed to things that are cancer causing, you just have a lot more life left, right, for that to cause problems compared to an adult. And then there are particular windows where kids are susceptible, right? So there's a great set of studies out of University of Southern California looking at chronic air pollution exposure and lung function that have shown that not only do kids that are exposed to higher levels of air pollution have lower lung function to begin with, but they have less growth in their lung function over adolescence. And so you sort of think through the long-term effects there, disrupting a growing system, right? If you sort of like change the slope of that growth, that might only be a little difference here, but as you go out over time, that makes a big difference. And then the fourth one that I actually don't have on this slide, but I often like to say, particularly in, say, late October, early November of election years, is that kids can't control a lot of their surroundings. And so they're really responsible. I mean, we're really responsible for protecting them, right? And that includes both in a macro level, making sure that we're, voting for policies that help protect children's health, but also sort of very specific. So the example I like to use here is that people often don't think about that one of the major factors for heat illness in small kids is being in a stroller or a car seat. And it's just that, if I'm sitting in a chair or you all are sitting in chairs right now and you get too hot, like you sit up, you move away from the back of the chair, right? But if you're strapped in with a 5-point harness, you can't do that. And so it's that same like, on a very, very local level, right? The kid is not able to control their environments. And so it's all the more reason that we all need to take charge of that. So the other thing to remember is that there are unique vulnerabilities during pregnancy, important for those of us that take care of adolescents who might be pregnant, but also to know for, prenatal consultations and all of that. In some ways similar to kids, pregnant people are much more metabolically active, right? They have huge increases in their oxygen consumption and minute ventilation and cardiac output. And then, of course, the fact that they're susceptible to blood pressure issues, right? Things that can affect blood pressure end up then having sort of an outsized effect on pregnant people. And of course, because pregnant people end up needing to come in for visits much more often than many healthy adults do, right? There's also that particularly acute disparity when people don't have good access to healthcare. Okay, so we're going to sort of jump into talking about some of our key concepts. The first one that I like to go over with folks is sort of history of the chemical environment in our country. And I do this because I at least had a lot of misconceptions before I got into this field. And so, hopefully if you guys do too, we'll correct some of these for you. So I used to think that if something was being sold in the US, that there was some sort of safety, something that had happened somewhere. Maybe it wasn't complete, but there'd been some sort of safety assessment that made sure that it was okay. And that's not really true. So there is an act that was passed in the 70s. It's called the Toxic Substances Control Act. It's often abbreviated TSCA. And it was put in place ostensibly to regulate and evaluate chemicals that would be going into consumer products. But the way it was set up, you have to do really, really detailed scientific assessments and almost entirely eliminate uncertainty before you can regulate a chemical. So the problem with that, as I have here, it was passed in the mid 70s. I think there's one, maybe two compounds that have completed a full TSCA review since the 70s. So that's, you think about all of the things that are on the market, every toy, right? Like anything that you or your patients is coming in contact with, most of that stuff just hasn't been regulated in any way. There's not necessarily a lot of science surrounding it, and there aren't regulations. There have been some efforts to reform TSCA. So 2016, the TSCA reform bill that got passed did two things. One was the prior one had basically grandparented in any chemical that existed before 1976. And so the TSCA reform said, no, just because it's been around for a long time doesn't mean it couldn't also be dangerous. So those should also get reviewed. And then it also made a priority structure thinking about chemicals that are particularly persistent, particularly bioaccumulative, and particularly toxic. Has tried to make some small changes in workflow as well. They've been moderately, slightly successful. Things have picked up a little bit, but we're still at like a handful of chemicals that have undergone this kind of review compared to the hundreds of thousands that are out there. So there's some interesting stuff happening in the regulatory space, thinking about, are there ways that we could move towards like class-based considerations of chemicals, right? Rather than having to evaluate one at a time. Because right now, even if you did a full TSCA style evaluation on BPA and finished that, BPC can come and replace that, and you can't regulate it at all until you do the same kind of huge full evaluation, right? And so the idea is that maybe we could start trying to move towards some sort of class-based regulation, but we're not there yet. And then there's barriers to knowing the contents of products. So you guys might know if you have like an adolescent who is working somewhere and they're like, I'm exposed to something, like, how do I figure out what it is? You can get a safety data sheet. That's what SDS stands for chemicals that people are working with. And in fact, employers are required to make them available for an employee. So, whether adolescents feel empowered to ask, we could have that whole other conversation, right? But those are theoretically available for them. But even those don't have to list so-called inactive ingredients. And that seems like that shouldn't matter. But one example where this comes up is that my colleagues and I did a review of disinfectant use in childcare settings, and whether or not bleach has surfactants in it. So the bleach product can have all kinds of different surfactants, makes a big difference in how much it affects people's asthma, both in terms of asthma development and exacerbation. But they don't have to list those surfactants because that's not the active ingredient. That's not the thing doing the disinfecting, right? And so there are all kinds of chemicals that are in products that even if you go through all of the steps to get what should be giving you the information on these safety data sheets, you might not be able to find everything you need. So it's a problem. So one thing that's useful for you guys, sometimes we'll get calls and we're happy to take them, but we'll get calls from someone who's had a parent that I always say sort of got taken advantage of and got convinced to send their child for an evaluation where they take hair and urine and test for everything, right? And so then you've got this lab result where you're like, I don't know, do we have any idea of what a child's urine cadmium is? How would I know? And so a really good resource that you can use is from NHANES. So NHANES is the National Health and Nutrition Examination Survey. They do a big nationwide survey every few years to try and get a sense of nationally representative information for health, kids and adults. But they have a subcomponent of it where they actually do clinical exams. And in that, they take biospecimens and then they analyze them for a variety of different things. So what's cool about that is that freely available on the CDC's webpage, even if you don't remember that exact link, if you just remember it's NHANES and they're testing, blood and urine samples, you can find it pretty easily through Google. And they have, data there for different age groups. They break it down by sex and a couple different ways so that you would at least be able to say, well, I might not know exactly what a urine cadmium level does from a health effect, but I can tell you like this is pretty similar to what all other kids have, or this is really wildly different, right? And so that can be really useful. It's a in some ways terrible stopgap for the fact that we don't have better chemical regulation, but it's at least a resource so that you can know if you're presented with that kind of stuff, what you're looking at. All right, we're going to move to a different big concept. So one of the major things that we've talked about in environmental health a lot in the last few years, and sort of more broadly, has to do with environmental justice. And that's the idea that, similar to lots of other fields, that we should be making sure that we have fair treatment and meaningful involvement of all people, regardless of race, color, national origin, income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And the reason that this has come up, right, is a backlash to what our policies have historically been, both in the US and other places around the world, where lower income populations and often people of color are getting much higher exposures at their homes and at their schools and places where they spend time. And that's for a variety of reasons, right? Things like where we choose to build freeways, where we permit industrial sites, right? All that kind of stuff. And unfortunately, there's also inequities in the enforcement, right? And so even if, in theory, the law is set up in such a way that the exposure should be distributed relatively evenly, if you have one population that has a lot more political capital and time to, push back on something, maybe their neighborhood doesn't get that new polluting facility, whereas another would. This one's a really cool paper that actually a colleague, so he was a joint medical program medical student at the time that he worked on this paper, published a few years ago. And this is looking at redlining. Are people familiar with that term? Right. So the concept that loans wouldn't be given out in certain neighborhoods, basically because of pretty explicitly racial discriminatory practices. So this is looking at 1930s redlining in San Francisco and ER visits for asthma in the 2010s. And so it's a nice illustration of, 80 years of time between those and how these patterns persist, right? There's the paper has similar visits. It's Nardone et al. 2020. It has similar figures for other cities in California too, if you're interested. But thinking about the environmental justice or EJ history, so it's a movement that really came out of the larger civil rights movement in the middle part of the century. But then sort of the landmark thing that people point to is a report in the 1980s called Toxic Wastes and Race in the US. And that's where we first, sort of coined the term environmental racism. There's definitely been increasing efforts to consider environmental justice and policy. So there's a couple examples here, an act in 1994, and then there was the creation of a advisory council just a few years ago that's considering these issues. but certainly not enough, right? It's still an ongoing, not only do we have the legacy of former discriminatory policies, it's an ongoing issue. All right, this one I'm going to spend a little bit less time on, not because it's not important, it's super important, but I actually figured you guys might get to hear about climate change from other people too, and you don't probably hear about the other environmental health stuff much. There's a really lovely AAP policy statement, if you haven't seen it, that breaks down the 5 major categories of climate-related health effects in kids. And these are the 5 they break it into. So one is heat-related illness. The second one is air pollution. The third is food insecurity. One of the things that policy statement goes through that I had never thought about before I read it is that not only do warming temperatures change the availability of food, right? Like it can change how productive crops are and all of that kind of stuff. The effect on natural disasters can wipe out whole crops, right? But in some examples, it actually changes the nutritional content. So not only do you have less food, but you can have less nutritious food because crops are really sensitive to changes in temperature. I mentioned natural disasters, and then of course, vector-borne diseases and other kind of infectious diseases can change their distribution with climate change. So also a super important area, definitely part of environmental health. And in fact, our division now is the Division of Occupational, Environmental, and Climate Medicine here at UCSF. So super important. I'm happy to take questions, but I'm, as I said, skipping it slightly just because I know that you guys don't get a whole lot of other environmental health stuff. You know, in terms of what pediatricians can do about climate change, there's sort of the adapt and the mitigate components, right? So just thinking about the spaces that you're in, you know, what can, like, if you're in a private practice, what can your office do to not only not contribute as much to climate change, but like, we might have more wildfires and I'm going to lose PG&E. And do I actually have multiple backup systems to keep the vaccines refrigerated and, you know, et cetera, right? All that kind of stuff. And then as much as you can engage in your local community and region. I've been doing a lot of stuff with the school district where my daughter is, and people are so excited to have a doctor. They don't care about the rest of my credentials, but they're like, oh, you're a pediatrician, come talk to us. And so, you know, to the extent that you guys can be that person in whatever your micro community is, just like emphasizing the importance of considering the environmental contributions to kids' health, it's huge. Okay, we've got 2 more key concepts to go. So one is just that there are different routes of exposure and different exposure pathways. And this seems like a really obvious thing, so I'm not insulting your intelligence. The reason I put this up here is that often people will say, well, I have no idea how to stop a kid's exposure to something. I didn't learn anything about it. I just don't know. And the nice thing about thinking through the exposure pathway, right? So you've got, let's say it's a factory that's our contaminant source, and then it emits some kind of pollution. That pollution is now in the air, right? The route is that the kid is breathing it in. That's their exposure. And then now maybe they have some health effect from it, right? Asthma, exacerbation, whatever. The idea of plotting out your route of exposure is any of those are potential sources or potential points for intervention, right? So it could be stopping the production, right? Get policy change to happen, et cetera, et cetera. It could be that you know, the facility could have better filtration or capture of their emissions. It could be that we do some sort of filtration of the air before it gets to the kid, right? So you sort of think through each of those steps as ways that are intervenable, even if you don't know tons of details about the toxicology. It's really easy to think through, okay, well, how does this get from where it is to the kid, right? And so it's a more easily actionable set of stuff. And I mentioned this at the start, but the built environment is something that we talk about a lot. You know, it's the concept that how the city, the school, all these places that you spend time at, how they're laid out and built can also affect your health. That includes things like, you know, greenness and park access and access to transportation, right? A lot of the sort of social determinants of health that you all probably think about a lot are built environment. The image here, so there was I used to work part-time at Cal EPA as well, and there was a heat symposium series that we hosted a couple years ago, had a number of different speakers. And you might be able to tell if you look at that thermal image long enough, but that's a playground. That's in Arizona. That's on a day when it's 86 degrees Fahrenheit outside. So that's why 86 is the bottom of the scale. And if you look, now that I've said it's a playground, you can probably see there's like the archway and there's two slides coming towards us. Yeah. So there was a shade structure that covers the top half of those slides. And so if you look, the difference between the temperature at the top half, I don't have an exact demarcation of the scale, right? But up at the top here, it's green. We're somewhere in the, 95, 100 kind of range there. Whereas at the bottom, where you're up at the 175, 180 degrees Fahrenheit on that slide, right? And so the simple difference between having a shade structure over it or not makes a difference between literally a kid getting a burn, right? You can get a skin burn in very few seconds at that temperature. And it's one of those things that you're like, of course, shade is good, whatever, right? But again, these are the kinds of things that you can advocate in your community for that are low hanging fruit. You can explain why it's bad for kids to get burns, right? And can really make a big difference. Okay. So I'm going to give you guys an example of one of the hazards, just to sort of walk you through if you were trying to look something up in the toolkit, and give you a little bit more background. Air pollution is my personal interest, so that's what we're going to do because I got to pick. And then we'll go through, and then in a few minutes I'll pass off to my colleague. So if you'd seen this news article or gotten a parent asking you like, oh, I heard there were some kinds of crazy protesters, something about air pollution in kids, like, do I really need to worry about that, doc? So we have a section in the toolkit for particles and nitrogen oxides. So those are two of the main air contaminants that are present sort of all the time in our air. Particles, so the image on the left is sort of a classic EPA figure that gets used. I'll be honest, I don't love it, but it's the one everyone uses. So I put it up so that I can orient you to it. So the idea here is that the big gray thing, the columnar thing in the middle, is a single strand of human hair. So what they're trying to show is that particles that we're talking about for air pollution, we talk about PM10, that's 10 microns in diameter or smaller, and PM2.5, 2.5 microns in diameter or smaller, right? 20 of those fit across the width of a single human hair, right? So this is microscopic stuff. We can't see it, but it is just sort of airborne dust. And that's often how I'll explain it to people, right? It's dust that's so small you can't see it. And they'll be like, well, no, but when the sun hits and I can see the dust, you're like, yeah, awesome. Exactly that kind of thing, but even smaller, right? But particulate matter is interesting. So it is one of the regulated pollutants by the EPA under the Clean Air Act. But unlike a lot of the other pollutants, so if I tell you the names of the others, right? So the others are like carbon monoxide, sulfur dioxide, those are chemicals, right? Like you could write down, I'm not going to make you, but you could write down a chemical structure for those, right? Particulate matter is different. It's just a size bucket. So it's anything that is that small. And so one of the problems with it is it's really heterogeneous, right? So particulate matter that comes from traffic, particulate matter that comes from wildfire smoke, they're similar in a lot of ways, but they're not exactly the same. And so exactly what source those things are coming from can make a difference in some of the health effects. And then the one on the right is NO2, nitrogen dioxide, slightly easier because I can actually give you the molecule. All right, so what do we know about health effects for these two pollutants? If you actually look in the toolkit, we have this all written out in text, but you don't want to look at blocks of text. So there's lots of data to support basically 5 main categories of health effects for both of these pollutants. That's respiratory effects. You guys all know that, right? Makes asthma worse, all of that kind of stuff. There's also some evidence that affects metabolism and growth. So kids who have higher chronic air pollution exposure tend to have a slightly higher hemoglobin A1C and be a little more obese. We don't have any obese kids, right, in this country. There are neurocognitive effects, right? So particles and nitrogen oxides can affect learning and memory. They are known carcinogens. So there's a group called IARC, the International Agency. Shoot, I'm really bad at acronyms. International Agency for Research on Cancer. I think that's what it stands for. But particulate matter is a known carcinogen. They have designated it as a carcinogen. And then they can also contribute to low birth weight and preterm birth. There's some debate about exactly which periods of pregnancy are most susceptible, and it looks like it may be slightly different depending on if we're talking about birth weight or preterm delivery. And there's some evidence of other effects as well. But interesting science happening there. But it's clear that air pollution exposure during pregnancy has effects. What kind of sources are we thinking about? So this is my little schematic. The far right picture, for those of you who lived in the Bay Area back in 2020, this was our Mordor day. That's actually a picture just out the window of the condo I lived in at the time. Interestingly, the reason that the sky was so red that day was actually because we had a really high smoke plume. So it's sort of funny. It's just a random tidbit for you, but people always get really freaked out when the sky is red, like much more so, the AQI can be whatever, people don't notice, but if the sky is red, they get really freaked out. We'd had like 6 weeks of really bad air quality in that time period. You might remember if you were around. And actually this day was not nearly as bad as the day before it or after it. And the reason was that the smoke plume just happened to go really high that day. So we didn't actually have as much ground level smoke, which is why our AQI wasn't as bad, but it was super, super high. And so that was what was blocking the sun more. And that was why we get that really weird red color. When it happened in the East Coast last year, they happened to have both high smoke and low smoke that day. So they didn't have that sort of dissociation. I thought it was interesting here. And then, of course, like industrial sources and traffic are major contributors. There's lots of data to show, for example, that kids that live within 300 meters of a freeway are much more likely to have asthma. Drops off exponentially as you get further away. And then cooking-related pollution is also a major concern. It's something that I've worked on a lot in the last few years. In the prevention tab of the toolkit, it has lots of different kinds of bullets of things that you can talk to families about or for your own families. So this is a little snapshot for you. On the left is the explanation of the AQI. I think one thing to know that I find pediatricians often don't know is that there's a ton of science that goes into that. So EPA does these major reviews of all the literature on an air pollutant every few years. And that cutoff between the good and moderate, and then the moderate and unhealthy for sensitive groups ranges, those are based on the EPA regulated thresholds. So the 24-hour EPA limit that you're supposed to avoid going over is the cut point between yellow and orange. The annual EPA limit that cities are supposed to try and meet all the time is the cut point between green and yellow. So what I always say to people is that unhealthy for sensitive groups category is anybody with any sort of chronic health condition, and all kids, right? And that doesn't mean that you have to stop everything, right? There's really important parts of kids' lives that we don't want to get disrupted. And, routines are important and mental health is important and all of that. But when you hit that unhealthy for sensitive groups point, that's where you should start thinking about, okay, I need to take some actions to decrease my exposure. So what is that going to be? Is it going to be, I run an extra air filter in the classroom today, right? Is it going to be whatever? And so thinking through the options. Speaking of filtration, if you have an HVAC system, it's like a central system, you want to make sure you have a MERV 13 filter or higher. Those are the ones that basically do a good enough job of filtering out the small particles. And I'll say it's an exponential difference. So sometimes people will say like, well, but I have a MERV 10, so that's close, right? Like that's almost 13. It's really not. The difference in the small particles that are filtered by a 10 or an 11 versus a 13 is huge. For portable air cleaners, you want to make sure that you're using mechanical ones, not electronic or ionic ones. So the mechanical ones, I mean ones that have like a physical HEPA filter. It's just pushing air through a filter. Stuff is glomming onto the filter. 2 reasons for that. One, some of the electronic ones actually produce ozone. So you're just trading one pollutant for another. That's not great. But the other is even the ones that don't produce ozone, there's starting to be more and more evidence that because you get all this downstream chemistry by just tossing a bunch of ions out into the air, you can have all kinds of wonky stuff that happens. And so there's some evidence that there's like changes in markers of cardiovascular health and those kinds of things related to having those ions released. And so I think it's definitely an area that still needs more work. But I would say for now, the safest option, because we know they work without those kinds of side effects, is to stick to the mechanical kinds of filters. DIY air cleaners can actually also work really well. The thing I always caution folks about with those is we don't have great long-term data about how long they continue being effective for. And so I think it's a great potential option for people if it gets them an air filter that they wouldn't have otherwise. But if they have an ability to get a product that has replaceable filters and all of that, I think there's some real advantages there. And then lower down in that section on prevention, there will be both a section on anticipatory guidance. That'll be things that are related specific to this hazard. But as I mentioned, actually, if you went over to the full anticipatory guidance page there, it's broken down by age like it would be in Bright Futures. And then we also have links to patient handouts. So that'll be if they're good, reputable sources from, for example, EPA, other government sources, other academic sources, we'll link to those. This, for example, is a set of infographics and videos that we made about having cleaner air when you're cooking. So this is, online, freely available. You could point your asthmatic families to it to take a look at. And then James will talk about every one of the hazard and source and key concept sections. Also has one of our really nice, I think they're really nice, prescription for prevention handouts that we've made for patients. So really quick before I punt to him, I'll just say I skipped over it, but we approached the air pollution from the specific chemical side. You could also go from the other direction. So this is the baby foods one, but there's one for air pollution, and go that direction and say, okay, I'm getting this question about air pollution. I don't know what's in it. If you go to this the exposure source side, it'll then list for you down at the bottom, maybe you should read these hazard sections. And so you can kind of approach it either direction. And then the anticipatory guidance, like I said, supplements Bright Futures, that same age breakdown, and just gives 2 or 3 at every visit that are environmental health focused. In my ideal world, someday I will get those into Bright Futures. So if anybody has any contacts, let me know. All right. I put this up at the start. I'm going to put it up again right now. If you weren't here earlier, please scan the QR code, grab the page, bookmark it on your phone if you can, so that when you need it in the future, you've got it. And then this is a new one that you hadn't seen yet, because these are our prescriptions for prevention. They are linked from each section of the provider toolkit that I was talking about, but they also have their own beautiful, snazzy web page that James built out. And I will punt to him.
Thanks, Stephanie. Great to be joining you all via Zoom. James Rocher-Nolan. For the record, I don't actually have a formal doctoral degree. Long story short, I got totally immersed in community-based participatory research as a grad student in public health. Started pretty much full-time and then some, living in a farm worker community doing community-based participatory research on pesticide exposures. And fast forward to almost a decade of UC service later, here I am. Working more on the community-facing side of things and taking these really technical, really heavy concepts and making them approachable to communities. So one such major endeavor here is our Prescriptions for Prevention series. These are based off of the very same topics from the PEHT. And I think one thing to note here is that, not only do we have, our classic, MD medical professionals contributing to these, but these also engaged students at UCSF and at other medical institutions as co-authors in and of themselves, as well as bringing in the public health kind of perspective as well. So in total, we had more than 20 contributors, which is really exciting for a series of this size. And again, covering these 30 key environmental health topics that correspond to those in the Pediatric Environmental Health Toolkit, which is the physician or healthcare provider facing tool Stephanie just overviewed. They have really simple overviews of the basic, core things you need to know about the specific exposure or hazard. We aim for 6th grade literacy level as much as humanly possible, although there's a little bit of deviation. Sometimes it's a little trickier. And really emphasizing these actionable low or no cost do's and don'ts. And we'll do a zoom in a second on what that looks like. Also really noteworthy here is that we have as many and as useful national level resources as possible. But at the bottom of each, there's still room for each of the users to add specific regional resources as well that might be pertinent. That's especially helpful if you're working with low-income or community colored patients, because sometimes there's free or super reduced cost things like radon test kits or lead test kits that can be really important for folks to access that they might not otherwise know about. Also really important to us, especially in California, but also in our dissemination of this tool nationwide, is that they're currently in English and Spanish. We're looking into the possibility of doing additional languages as well. So stay tuned. It's really exciting. And also of note here is that, this tool is powered by support from my colleagues at UCSF's Environmental Research and Translation for Health Center. So here's the full breadth of what the prescriptions prevention cover. Each of these bullets represents a standalone fact sheet that's part of this whole series. I won't read all of them off to you, but I think it's helpful to kind of see the breadth and the array of different materials that we have. Especially in the hazards, I think some of the more common ones that we get questions about are things like asbestos, mold, pesticides, and PFAS are really big ones. In our sources, of course, Stephanie was talking earlier about baby foods being in the news. So there's lots of traction on that concept or tool specifically. Other things like natural disasters as well, we get extra consults on, and plastics seem to be gaining a lot of traction as well. And we just released a series of 7 concepts that are live on our website, and we're looking for other ways to disseminate them as well. Thinking about the basic kind of principles of environmental justice and, the unique vulnerability of children and pregnant people.
And you think
Next
it's tough
slide,
to get,
please.
those other components into a patient-friendly language. Trying to figure out how to boil down those concepts onto a one-page patient-friendly handout was a challenge.
Yes, absolutely. Yeah, and it takes a village, right? At the minimum, I think I lost track, but each individual fact sheet had at least, 7 to 10 reviewers, and it's really, really tough to get them to fit and get them in accessible language. So here's a kind of zoom in of one of such prescription for prevention. This one, particles and nitrogen oxides. You get this really simple, 3 to 4 sentence overview. On the left column, you've got our do's, again, with these national level resources as feasible. Things that are low cost, like N95 masks, different tips and tricks for folks to reduce their exposure at home, as well as in their community. And kind of towards the bottom of this specific one, having a DIY box fan filter, which are, relatively low cost, but also a lot of bang for your buck. They have a large amount of air that they can filter, which is really helpful for folks that don't have access to, more sophisticated and expensive tools. And even more importantly, I think for this audience, and hopefully of great interest to you all, is that we have presented and reviewed all 30 hazards and sources, prescriptions prevention with UCSF's Patient Education Committee. And thanks to those folks for their diligent review and support. It was really good getting to work with them over almost the entire last year. This is an idea that started by our colleague, Dr. Maria Zlatnik, who's over in OBGYN. And we used her 5-page pregnancy and climate change fact sheet as kind of a proof of concept. And once we get that reviewed and approved, it really inspired us to get all 30 prescriptions and prevention exposures and hazards through the system as well. These are really helpful because they allow for the ease of review during the clinical encounter, and also can be easily added to aftercare summaries or after visit summaries. And I'll give you little tips and tricks on how to do that in a second. Here we go. Perfect. Yeah, thanks so much. So this is how Maria does it. And there's a couple ways you can do it. This is one of the ways that's a little bit easier to do. If you're, in your visit, you can go to the top tab wrap up. And right down there under patient instructions, you can just type in prescriptions for prevention, and it'll give you the full series, which is in the next slide. It'll give you a little visual of what that looks like. So here you have all 30 of our prescriptions for prevention. And again, they're in both English and Spanish. So there'll be 60 total that'll show up. And noteworthy here is that, of course, you can pick the one that's most pertinent for your encounter in real time. But you can also favorite the ones that you think you're going to be using or referring back to most frequently with additional patients. So in this context, asbestos, BPA, and carbon monoxide were ones that were frequently used by this healthcare practitioner. Another way you can do it, and I can share out the link to this PDF as well with folks in the chat, as well as in a follow-up email, is you can go to your patient encounter, click on more activities, go down to references, and then the kind of default is that it'll show you like this full master index. And in theory, if you go to PE, prescription prevention, all of them will show up, but you can also click once more and get into a search box and then search for the prescriptions for prevention series specifically. So really, really helpful. Again, all these are live in the system right now. So really encourage you to check those out next time you're in clinic or looking at your patient records. Really great tool.
And you may have noticed the ones in the system are just text-based because that's what Epic can handle. But those pretty versions are also free and available on our webpage. So if you ever found that you were using one a lot and wanted the fancy one, you can always grab that too.
Yes, yeah, absolutely. Yeah, they're all publicly facing on our website in the fancy PDF format. And every single one of them also has a dedicated social media post, and we post to 4 different social media channels. So really helpful in trying to get the word out to patients directly, but also via healthcare providers in the clinic. Thinking about those multiple simultaneous ways to reach people where they're at and kind of build that foundational environmental health literacy. Another way that we do that is via animated public service announcements. And this was, a project that we started a little bit more than a year and a half ago, maybe 2 years now. Thinking about, people are really sometimes challenged to think about the complexities of these topics. So making sure that they have visuals, having a narrative, bringing in characters that are of interest to them, and so on and so forth. So we've got more than 3 prescriptions per prevention videos at this point, but at the time we took the screenshot, there was just 3. Again, these are also in English and Spanish, but we've got a whole nother series of additional topics, that cover a breadth of other challenges like cleaning products that are in additional languages as well. And we're continuing to look for more language translation opportunities. And here's our, prescription prevention main page again. If you're quick on the draw, you can scan our QR code. And right now I'll throw in the chat how to access these materials in Apex. Thanks so much, y'all.
And I'm happy to take questions. I'll also just say our website more broadly is a wealth of information. This is our whole mission is to educate providers and the public. And so we have like lots of stuff there that we've made, and please use it. And we're also always available if there's something that we can help with. So I love, being the good pediatrician that I am, and the fact that this came from the AAP Green Book. I like to add the, take a look. It's in a book. Now we've got it on our mobile device with the PAHT, but you don't have to take my word for it.
That was great. Thank you so much. I actually had no idea that there was so much work in this area going on at UCSF.
There's a ton, yeah. And there's actually, so we're part of a nationwide network. So there's one of these PACEUs for each federal region. So like if you know about the federal court system or any of those, same breakdown. So we're based here at UCSF, but we cover California, Nevada, Arizona, Hawaii, the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, Federated States of Micronesia. What am I missing, James?
Hello?
Palau, Republic of Palau. So we have a pretty wide area, and that's part of why we have so many online resources is we can't physically be in all of those places all the time. Hello, Snow White.
Any questions from the audience? There's one question on Zoom, and I think you actually answered part of this question with your talk about air filters. But it came up before you presented that piece, and there's part of it that I'm not sure you answered.
Sure.
How do we know which air filters are effective for filtering out foods and viruses? So those.
Really good question. So the viruses that get filtered by these kinds of filters are the ones that are particle bound. So the same kinds of filters that are going to filter particles, which is your basic like HEPA, MERV13 kind of filter, will filter the viruses that are particle bound. It doesn't filter all viruses because the ones that aren't particle bound are generally small enough that they can get through. That's the simplest version. There's, some complex science about do sometimes some of them attach and maybe and blah, blah, blah. But essentially what you're looking for is still just something that filters particles because it's the particle bound viruses. Funny enough, actually, allergens are the same way. The reason that these things are helpful for allergens is that there's a bunch of particle bound allergens. They just glom onto the particles. And so then when you filter the particles, it's grabbing allergens too.
And then I have a question, and that is, as I work mostly in the inpatient setting, so I don't know all of these resources.
But they're relevant for your inpatients too.
Yeah, sure. But I'm like, I don't discharge patients from the hospital that much.
I know.
But yes, I should know about all these things. But I'm wondering, are you looking at the uptake of these materials in our outpatient clinics, primary care clinics, and then harder even probably to do the downstream effects of that?
So we would love to look at the uptake in the clinics. We are working on trying to figure out how to do that. We aren't yet, but we would like to. We just got the full set rolled out. We also have a couple of projects. So we have funded for next year, working in North Richmond here in the Bay Area, this environmental justice community, and working in Maui, because there's a bunch of money for environmental health concerns in Maui right now. Working to do some similar, figuring out, the best way to integrate into workflows in those places, and do some follow-up dissemination, sort of, talk about things with the providers and folks, and see what the uptake has been like. And so we're definitely working on it. We're hopefully applying for some more money to do some more of that. But yeah, if there's ever, if there are interested trainees that want to work with us on these kinds of things, we have lots of fun things going on. So.
And then my last question.
Yeah, keep going.
Since we have our residency program director here, do you feel that we need to integrate more of this training in this regard into our training programs?
Yes. Yeah, I mean, I think there are always great opportunities for how we can incorporate more. So one way to do it is we do have an elective rotation on the books for the residency. And so I super encourage anybody that's interested to come spend time with us. There are all kinds of fun, interesting things going on. You'll get a chance to get exposed to things that I at least wasn't exposed to a whole lot in residency, in addition to the environmental health content. We do a lot of stuff that interfaces with like government and policy. And so sort of learning about like, what's that like? Like, you don't have a whole lot of time as a resident to go to a National Academy Zoom, but go to a National Academies workshop and like, what is this like? And what kind of experts are here? And you can do that when you're on rotation with us, right? So I think it's a really great learning opportunity. We've had a few pediatric residents take us up on it. So Sonia Swenson, for example, a couple years ago, loved it and decided to shout from the rooftops, which we really appreciated. We also take residents from others. So we have some family medicine residents from UCLA that rotate with us, and we take almost all of the occupational environmental medicine residents, and I convince them why they need to care about children. But yeah, we would love to have more peds residents. Happy to talk about it. Compared to your like inpatient rotations, it should be actually like a nice break and a chance to do something different with your brain. But you'll get to learn a lot. So we love having you guys. And yeah, we've been trying as much as possible to, I'm always available for talks. I spoke for the ZSFG morning conference a few weeks ago. And so, yeah, we're around. We have, tons of expertise and would love to share it.
There's a last comment here from the Zoom from Dr. Hurd, who says this is amazing. Thanks for integrating patient instruction.
Absolutely. Who is that from?
Dr. Hurd, HURD.
HURD. Okay. I was wondering, I know another Dr. Hurd over at Oakland. So I was like, that Maureen.
All right. Well, thank you so much for being here. It always strikes me when people say things like that. I convince people that they have to care about children.
I know.
Really grateful for the work that you both do and for presenting here at the end.
Thanks so much.
Thanks, Al. Great chatting with you.